You know how persons can give you health advice most times unsolicited. You didn't even ask for it, and they just, tell you what to do because they see that your child is going through something or you're having a condition, a sickness. Probably they've even gone through it before. It's very common in my part of the world and in other parts of the world. They're doing it out of their goodwill, right? They mean well for you, but meaning well for you is not good medicine. It's not safe for you. And so, because I've gotten lots and lots of questions in this regard, I decided to talk about it. Today, we're going to be talking about unsolicited health advice and how it is unsafe for you. In fact, this is a medication safety tip. So we'll dive into it. I got a call from someone, and she was like, her child was having jaundice. It was taking time to clear up, and I'd advised her earlier to go to the hospital, but she had told me that there were improvements. And later on, she called me and said, "Oh, someone asked her to give her child Ampiclox droplets." And I'm like, "Who asked you to?" And she said, "Oh, it's just someone that passed by." And I said, "Don't give your child Ampiclox because jaundice is not a bacterial infection. It is actually a newborn disease that can be treated with phototherapy, like light therapy. It could be in the hospital, it could be at home where you just, put your child in the sun early in the morning, not the harsh sun, but the one that comes out mildly very early in the morning, and then with time it will clear up. I checked up on her and it has cleared up. She didn't have to give the Ampiclox, and her baby is doing quite well. The baby I'm talking about is not was not even up to a month old as at the time this thing happened. So those advices will come in different forms. It could be from your relatives, it could be from your well meaning neighbors, it could also be from your colleagues or even your siblings, right? They mean well for you, but it is not safe for you. So, we're going to be talking about the dangers associated with unsolicited health advice. Now, the first thing is it will lead to antibiotic misuse. Just like this lady was told to give Ampiclox. Ampiclox is actually an antibiotic and was not even needed in that particular um, condition her baby was having. So if she had given Ampiclox, it would have started a cascade of antibiotic misuse, such that maybe later in the future, if the child actually now has an infection and needs Ampiclox to clear up the infection, it will not work for the child because Ampiclox has been misused in that child severally. And this is what misinformation can do. Unsolicited health advice most times is misinformation, wrong information that persons are giving to you. So that's one of the dangers that is going to cause antibiotic misuse. So that's the first one. The second danger of unsolicited health advice is that it could delay proper treatment. I was also in a bus one time. We're headed somewhere, and a passenger just like me coughed or had something wrong with her throat or something, and the driver quickly told her, "Don't worry, when you get home you can just use ginger." And I'm like, from where to where? How are you just giving advice? You're not even a medical professional. Shouldn't this cough be checked out? This could just be a symptom of maybe an underlying condition. It could be pneumonia, it could be asthma. Cough is not just cough most times, right? And this woman can actually take the advice of the driver and start taking ginger and delay proper treatment. The cough may eventually go, but later on, the real problem, the underlying problem will now come to the surface. Should have delayed proper treatment. Thirdly, your medicines can actually interact with these, herbal remedies. Now, the example I talked about earlier, she was asked to take ginger, right? Now she now takes ginger, and probably you did not know she was on blood thinners. And of course, you know that ginger, makes the blood thin. And if she's already on blood thinner, there's going to be an increased thinning of the blood, which is not what we want. So she would have ended up not just delaying proper treatment, but also putting herself at risk, because the person giving this health advice doesn't even know the medicines she may even be on. Not just blood thinners, it could be, blood pressure medicines, it could be she could be diabetic. So all of those, factors need to be considered before you can, make a decision on the right medicines for one to take. The next one is that you could end up using fake medicines or even expired medicines, because some of the persons that are giving you this health advice, right? Some of them don't stop at just giving you the health advice. They'll even give you leftover medicines, something they have used before, okay, that worked for them in that same condition, and then you want to take their advice and you want to use it too. They might have even had this medication for a very long time in their homes, right? And maybe they are not even stored properly. So you'll be taking medication, but you're not taking, medication that is in good condition. It could even be a fake medication. It could have expired while in their homes and they didn't even remember to check. Oh, because they're trying to do you good. So let's be careful when we take unsolicited health advice from persons. What you can do is, when they offer you this, this unsolicited health advice, seek to, get clarification from your health professional. It was the best thing that lady could do, to have reached out to me. If not, she would have used the wrong medication for a condition that didn't even need medicines. So reach out to your health professional. It could be your doctor, it could be your pharmacist, it could even be your nurses, right? In cases of family planning, because someone else also told me how someone, a well-meaning neighbor or a well-meaning friend had told her that she shouldn't adopt any of the family planning methods, that she was going to bleed to death. And thank God she had the wisdom to go to, a primary health center where she was educated on the different types of family planning method, and she chose one, and it was good for her body, right? And she's enjoying the benefits now. So if she had listened to that person and did not bother to adopt any of the family planning method, she will keep giving birth and giving birth, and not know that there's a solution where your body can actually rest, heal properly before you take in again. So don't just take people's word for it. They mean well for you, but check up with your professional, right? Go to the hospital, get information, go to the right source. It is very, very important for your health. So you're not putting yourself at risk. I don't know what information anybody has given to you. If you're watching this video right now, look up the authorities in that particular area, whatever it is, the information that you need, and go for the right information. It is as important as taking the right medication for the right illness, for the right condition. It's not just about taking medication, it's about, getting the right information at the right time. So people want to help you, yes, but don't be misled by unsolicited health advice that doesn't have basis, not from trained professional of any kind. Stay safe out there, and don't forget that when you stay informed, you will stay safe. Until I come your way again, my name is Matilda Inibe. Don't forget to like, share, and subscribe to this channel so that you can get more medication safety tips. Until I come your way again, bye.